A question I get a lot is, can I take medications? I know I had to have all these restrictions when I was pregnant. Can I drink a glass of wine? So what I want to explain is the difference between breastfeeding and being pregnant. So when you're pregnant, you have a direct IV to your baby. What you consume goes straight into the baby's bloodstream. When you're breastfeeding, it's got to enter your stomach, then into your bloodstream, then into your milk, then into your baby's stomach, then into their bloodstream. So there's many different factors, lots of layers of protection. So medications, I get questions all the time. We're lucky enough to have Thomas Hale. He writes a book every year called Medications in Mother's Milk. And it's literally every medication you can possibly imagine. And it tells you how long it stays in your system and whether or not you can take it while you're breastfeeding. The general rule is, besides illegal drugs, the only drug that you cannot take while breastfeeding is cancer drugs, drugs that kill white blood cells. Besides that, there is always an alternative. So there's a great website called LactMed, and it's free to everyone. Or if you really want to know, you can purchase Medications in Mother's Milk. There's a new edition every year, and it explains the class, so how dangerous it is. Does it go into the breast milk? And if it does, how long it's there. So to put it in perspective, it would be safer for you to be put under anesthesia with propofol than to take a Percocet in terms of your baby. So it's not always exactly what you think. So if you're very concerned about a medication that you're taking, say for postpartum depression, for anxiety, it is much, much safer to take a prescribed medication than to use, for example, marijuana to reduce your anxiety. Marijuana stays in the bloodstream for a long time, whereas Xanax does not. So it's really working with your OB and the references to see. First question is the half-life. How long does it stay in your system? The half-life tells you when it peaks, and you just double it and it'll tell you exactly how long the medication is in your bloodstream. Another question I get a lot is contrast. For example, if someone's getting an MRI and they want to do it with contrast, absolutely safe. But again, you can use the resources at LactMed to look up the information and see if it is safe for breastfeeding. My advice, just do your research beforehand. All pharmacists use the Red Book. Every single medication in the Red Book says, please consult your doctor if you're pregnant or breastfeeding. It's a blanket statement on every medication. I want you to be able to breastfeed for at least a year and live a normal life. So the deli meats, the soft cheeses, the sushi, all that you had to give up when you were pregnant does not apply when you're breastfeeding, because you don't have a direct IV to your baby. Going through, for example, postpartum depression, Zoloft is a very short half-life. It's undetectable in breast milk. And LactMed and Medications in Mother's Milk will tell you what percentage of the medication gets into the breast milk. Alcohol, another question I get a lot is, can I drink while I'm breastfeeding? The recommendation is if you are over 0.08, if you are legally drunk, then you would want to pump in replace of breastfeeding. So go to your DMV guidelines, look at your weight and the amount of drinks that you can drink per hour. If you are under 0.08, under being legally drunk, so if you can drive a car, you can breastfeed without any problems. It's just if you get past that point and have a crazy night out, then you would want to pump and store that milk. You really don't have to pump and dump. So you have resources for medications, LactMed and Medications in Mother's Milk by Thomas Hale.